Well, the role of the County Council of Stockholm is to provide for healthcare and finance healthcare in the entire Stockholm region. So the national government in Sweden has a limited responsibility. They just set the overall legislation and policies on healthcare, and then it's up to the individual county councils and regions to then finance healthcare. We levy our own taxes, and then we also fund our hospitals and our primary care clinics and psychiatry and other parts of our healthcare system in the region. We, from the County Council side, we have a lot of tools to work with when it comes to both planning for healthcare and assessing the quality of healthcare, and also then planning for the future healthcare to find new ways of delivering even better and more efficient and more safe healthcare for our citizens. So we work with several aspects in this. The first and I think most important aspect is that we have an open way and transparent way of producing data in healthcare, because a big source for change and renewal and innovation in healthcare is to openly show the quality between the different clinics, between different hospitals, and to really have a learning in between parts of healthcare. And we do that by having both quality registries where we assemble data from specific treatments and diagnosis, which is then assembled in a registry for monitoring and follow-up of the quality and outcomes of treatments. And they are also then published online, available for everyone to see. And we also compete in between the regions in Sweden. So the quality data from the Stockholm healthcare is then compared to the quality of care in Gothenburg or the southern part of Sweden or the northern part of Sweden. So we really have an open and transparent way of competing to be the best healthcare provider. Yes, because we try to be very clear to our hospitals and our primary care centers and also the private care providers working in the region, because they are funded by us. So in the policies and the agreements we have towards our care providers, we have clearly stated that they need to deliver quality data to us, and that data is supposed to be available both for us and for the public to see, because we want also to allow the patient to read this data. Where is it safest to have this kind of treatment? Where would I go with the shortest waiting times or the best interaction between the doctor and the patient, for example? So all this data is published online, and this is a requirement from our side as a financer of healthcare in Stockholm, that if you want to establish yourself in Stockholm County Council, you have to comply with these set of rules that we have set up. Mostly it's, the indicators and the quality metrics, they are set by the clinical experts in the hospitals and from the researchers' side. So, for example, here in Stockholm we have the Karolinska Institute who work very closely with us to set the overall framework on how you measure quality and outcomes in healthcare. We set some of these standards on the regional level, but also agreements in between the regions and the national authorities. So we have a National Board of Health and Welfare, for example, who is a national agency under the Ministry of Health, and they also set some obligatory requirements for all counties and regions to comply with. So it's a mix of both national standards on certain metrics, and then we have our own regional follow-up as well. Yes, it's no difference between a public and private care provider, because, for example, in primary care in Stockholm, 60% is private and 40% is publicly run. Everything is publicly funded, but it's run by different stakeholders. But the same rules comply to everyone. So a small private GP office or primary care clinic, they have to comply with the same standards that we also put on our own public health clinics. I would say perhaps it's two aspects, because one is that you're getting more popular with patients. If you're on the top of a list, you will be the first choice of many patients who want to list themselves at your clinic, because we have a free choice in Stockholm when it comes to both primary care and many of our open parts of our hospitals, special clinics. But it's also a matter of reimbursement, because if you comply to our regulations and deliver all the data you need, you get also the maximum reimbursement from the county. And there's also some incentive funds if you reach some quality levels, for example. Sometimes there are national funding for, well, to boost the knowledge and the treatment methods in psychiatry or in primary care or some other parts of healthcare, and then you have to comply with certain quality standards even there. Exactly. And the main, as I think, the use of data, as we use it in Sweden, is the basis for research and innovation throughout the healthcare system. Because with this new knowledge, so if we know which kind of treatment gives the most effective results, or well, treats the patient in shortest time, or are most cost efficient, or whatever, then you can also speed up the phase of introducing a new drug or a new treatment method or a new technology that is actually providing better care than the old technologies or the old pharmaceuticals. So this way of measuring quality and outcomes is really the basis for working with improvement and renewal in the healthcare system in Sweden. Well, it's important to see that this way of collecting data is not only for us as a financer to say that are you following your budget constraints, but also this is a learning experience for the healthcare providers themselves. This data is a source of knowledge and a basis for research and improvement and innovation on the local level. So I think the driving force for the individual doctor or nurse or health clinic is that they get knowledge on how they work and how they could work in a better way to provide a safer care or a more cost-efficient care or better accessibility for patients and so on. So we really use data as an incentive for driving this change. So it's not only to slim down or trim the healthcare system. It's actually, we provide a resource that is knowledge actually, and everyone wants to know if this new drug or this new way of treating patients are actually the best way of delivering care. It is, and I think Sweden has a long tradition of working transparent in the public sector, because we have an Openness and Transparency Act since I think 1650 or something. It's really for centuries we have been publicly publishing all documents and decisions from the public sector. Newspapers or individual citizens can read what I'm doing as a politician here in Stockholm. They can have access to my emails or to my decision papers after they are decided and so on. So it's very open in the public sector in Sweden. And the same goes for healthcare data.
So everyone has access to it?
Yes. So if you are a citizen in Sweden, you have a right to have a transcript of what's happening here in the County Council of Stockholm. It's actually no limit. You, as a citizen, you have to pay for the paper copies if you want paper copies. Otherwise, it's free of charge, and we have to comply with that openness also as a public entity.
Okay.
I think all countries and all healthcare systems need to focus much more on ambulatory care and on primary care, because it's mainly to also prevent people from falling ill, to work with healthy lifestyles and preventive health in different ways, and supporting the individual to stay healthy. And where you today have smart technologies that can help patients of not falling ill with smart connected watches or health bands you can have, or sensors on your body, and those kind of solutions can also help patients with chronic diseases, for example, to stay healthy and live independently outside the healthcare system. And that's where I think the ambulatory care is very important, because in the old days, the number of beds at hospitals were the only thing you counted when you counted quality in some way. But today we know that it's not good for you to stay at a hospital. And today you can have day surgery for fairly advanced treatments that for only 5 or 10 years ago it required perhaps a week in the hospital. Today you can go home after 2 hours of surgery. So it's changing very quickly, and we now have a big plan here in Stockholm where we shift the focus from the large hospitals and put more focus on the smaller hospitals and the primary care centers to really increase the availability for healthcare on the local level. We need highly specialized care, but the ambulatory care is extremely important, since there are the big flows of patients as well. Well, it's a bit simpler for us, as they are all funded by the county council. So we have some privately financed small clinics, but they are so few, so we can put requirements on them at a larger extent than other countries can. That's all the Nordic healthcare systems are built in the same way, since we are tax funded in that way, and they are employed by us mostly. But we also try to form a joint plan for all parts of the healthcare sector. We have, a couple of years back, we launched a large investment scheme called the Future Plan for Healthcare in Stockholm. And that was a big plan of both expanding and renovating our hospitals. We are building the new Karolinska University Hospital, which is the largest one in Northern Europe. But we also focus on shifting that kind of care, but it's not longer needed to be in hospitals, that can actually be done in a person's home or at a primary care center instead, or at the smaller hospitals. So in this future plan, it also includes to shift health professionals from the big hospitals out to the smaller clinics, to really have a stronger number of nurses and doctors on the local level, not only in the hospitals. So it's a big shift for us in Stockholm. I don't have the numbers in my head actually, but the trend is actually, I think, at least, so if you count the numbers, it's the majority of patients visit ambulatory care and primary care in the first hand, and the numbers going to highly specialized care is getting smaller. But the treatments carried out in the highly specialized care is getting more and more advanced, since our technologies and pharmaceutical development is going very fast. So I would say it's when it comes to money, the hospitals are still the same as before, since treatments are more expensive, but the numbers of patients are diminishing year by year. Well, we have put now both innovation and digitalization of healthcare on the top political leadership level in Stockholm County Council, because my position as Commissioner for Innovation and e-health is the first one in Sweden actually, and dedicate my time mainly on innovation and digitalization, because we saw the need to use these two tools as a driver for change and renewal and improvement of quality in the healthcare system. So my main focus is to to abolish factors that are actually hindering this development, because we know that the time from you get an idea to you implement this in healthcare, it could be a new drug, it could be a new smart technology, it can be a new way of working, that can take many, many years. So our work now is focused on modernizing both our reimbursement models, how we do procurements, how we work with change management on the clinical level, how we can, we have also formed an innovation fund internally in the region in healthcare. And especially on the technical side, e-health and digital solutions is so important for us to provide a healthcare that is perceived as modern and based on my needs as a modern citizen. Many healthcare systems are used of just letting the patient come when it fits the healthcare system, but in a more individualized based healthcare system as we are trying to create here in Stockholm, you should be able to come to the healthcare sector when you want, and you can schedule your appointments online. You should be able to have a video conferencing with your doctor on a screen instead of meeting him or her in the classical way. You should be able to have online treatment, for example, on the web or through an e-service when it comes to therapy and other things that we have tried with good success. So these kind of e-health services are now launched on a larger scale, and we also try to mix creating incentives for this development, but also increasing the requirements to meet some basic standards that you have to comply with certain basic digital requirements that you have to be, as a health center in Sweden or a hospital here in Stockholm, you have to deliver some kind of basic digital services for online booking of appointments, for example, or renewing your e-prescription online, or reading your medical record online. So these are examples of requirements that we're now putting on our health providers. In Sweden, almost all prescriptions are now digital. It's between 95 and 98%, I think, of all prescriptions. So if you have a standing prescription, if you have a chronic disease, for example, or if you control your blood pressure year after year, for example, you can just go online and renew your prescription on a secure website, which is the same in all parts of Sweden. And that makes it much easier for patients who don't have to call or visit their doctor for a drug that they just take every year. We have a higher service level towards the patient because we can then offer a modern e-service instead of requiring that the patient walks through the door and meets the doctor for 5 minutes when it's no use. So we can save time for those patients who actually need that visit instead.